Hello, I'm Marcus Boston.
And I'm Renee Boston.
And we're both medical malpractice attorneys practicing law in the state of Maryland. And today we would like to talk with you today about stroke misdiagnosis. Now, the basis of today's video deals with a call that we got a couple of days ago, which dealt with the issue of a stroke being misdiagnosed. But what we want to talk about is the difference between the types of stroke and why being able to determine the type of stroke is very important in these type of situations. Renee?
Well, I'll start off by telling you guys that there are two main types of stroke. One is the ischemic stroke and one is the hemorrhagic stroke. When you think of the hemorrhagic, think of hemorrhaging, like bleeding. So that's the basis of the hemorrhagic stroke. It's the bleeding of the brain. It's a sufficient amount of bleeding all at one time. It's very instantaneous kind of a action with that. The ischemic stroke is the most typical type of stroke, and I think it occurs the overwhelming majority of times in stroke patients. This is when a clot occurs, whether it's blood or air or anything like that, but it's a clotting that occurs in the arteries that lead to a stroke in the patient. So that's the difference between the two types of strokes.
And now, why is it very important for doctors to be able to determine the type of stroke?
Well, there are differences in how each one is treated. For instance, with bleeding, you don't want to give anybody anything that's going to, like a blood thinner, because that's just going to increase the bleeding in the patient. And that is usually what is given to ischemic stroke patients. So it's imperative that when a patient first presents to the hospital with stroke-like symptoms, you know, you got the facial drooping and the speech and things like that, that as soon as they get to the emergency room, the first thing that needs to happen is a CT scan needs to be performed on their brain to determine what type of stroke it is. And based on that, that's the way the doctors can determine which course of treatment is best for that patient.
So guys, why have we taken the time today to explain this to you? Because we realize that if you're watching this video right now, you have questions. You want to know whether your stroke was misdiagnosed, whether signs and things that were present that your doctor should have saw and should have acted on. And you're wondering, is this medical malpractice? Well, this is what we invite you to do. If your matter happened here in Maryland and you have questions and you would like to speak with someone further about it, you can pick up the phone and give us a call. We can be reached at 301-850-4832, or if you prefer, you can send us an email to medicalinjury@bostonlawllc.com. We answer questions like yours all the time, and we will be glad to hear your story. Well guys, that's it for today's quick, short educational video. Again, I'm Marcus Boston.
And I'm Renee Boston.
And we will see you next time. Guys, take care. Have a great day.